This part 3 of my lecture is continuation on the topic of antacids. So in this lecture, I want to tell you what will happen if you will take antacids individual as a substances when you take them for a long period of time, what kind of problems they can create. Let's start with this one, calcium carbonate. So I already explained previously, so they all will neutralize hydrochloric acid in the stomach, and by doing that they will create a numerous problems. So decreased concentration of hydrochloric acid, so it will create a weaker immune system, it will contribute to osteopenia. Well, maybe I should reverse those. So it will increase chance of osteopenia, it will increase chance of osteoarthritis, so because of decreased absorption of protein. Now, so that could be a problem, the set of problems by decreasing hydrochloric acid. So now, what happens when you take or patients take calcium carbonate? So calcium get absorbed through digestive tract. Calcium is as ion 2+, will go through the wall of digestive tract and get absorbed into the bloodstream. Concentration of calcium in the bloodstream is very tightly controlled. Usually when you go and draw blood, they will give you between 8.6 to 10.6. It's nanomicro, depends on the laboratory, but the number is, between 8 and 10.6. Okay, micrograms per deciliter, depends which one laboratory you are going, so they will have a little bit different numbers. Now, as you consume more calcium, concentration will go to 10 to 10.6. The further it goes, so the higher concentration of calcium here. Okay, body cannot tolerate that. This is homeostasis. It's a medical term. It means that if a concentration of calcium in the blood will go higher than this number, patient becomes sick, and if you don't correct the problem, patient actually will die. So, it should have to be handled. So body tries to get rid of that extra calcium. Well, it can go to two different directions. One direction is actually, if you will push in that direction, it will go into the bone. So let's suppose this is your bone. Okay, this is your bone. So if in patient who has osteoporosis and osteopenia, when they take supplements of calcium, they hope that this calcium will go here into the bone. And I say correctly, they hope, because I never hope that it will go there. I tell my patient, if you want the calcium to go here into your bone, you have to do few things. And the few things, it's the increased concentration of vitamin D. Make sure that vitamin D will sit here. Actually, it will sit here on the surface of the bone and push calcium there. Okay. And the second is very important, is weight-bearing exercise. Suppose patient does none of that. Okay, he has a vitamin D low, does not do weight-bearing exercise, so the calcium does not go into the bone. It still keep rising because you take calcium carbonate as antacids. Where it will go? It actually will go into the kidney. Okay, and here is the kidney, and here is the calcium, and it will go out into the urine. Okay, as calcium goes into the kidney, some patients unlucky, and actually I think that was unlucky, the percent of unlucky patients, I think 24% of people, if they take extra supplement calcium and do not push this calcium into the bones, they actually will excrete and form, 24% will form kidney stones. So you can see how supplementing calcium without knowing what you're doing can contribute to a health condition. Just one more thing came into my mind. I see from time to time senior patients come into my office and they say, well, my doctor told me that I can do this, take calcium containing antacids, so they will build my bones. Okay, I don't like when the medications recommended for different reasons indirectly. The goal of antacids is combined with hydrochloric acid and decreased acidity in the stomach. So to make sure that you don't have acid reflux. If you take it on regular base, you will create this problem number one, okay, and then you will create this problem, kidney stones formation in there because of excess of calcium. Please don't do that. Okay, so now if you will take on regular base increased calcium carbonate, okay, so the problem is possible. One of the possible problems is kidney stones. Kidney stones. Okay, so suppose you are taking antacids that has magnesium, okay, magnesium carbonate, magnesium CO3. Okay, magnesium is actually a laxative, and I recommend patients to take magnesium from time to time if they have a constipation. So how magnesium does work? What it does, it affects the muscles that actually make a wall of digestive tract, and they make it much wider. Okay, so you can see how much wider it's become. And that's what it creates actually diarrhea. So they become nice and wide, and everything moves so fast through the digestive tract. And where it's moving right here out of digestive tract. So if you're taking magnesium supplement and you have diarrhea, so the consequences of that is everything is moving fast through digestive tract, low transient time. The transient digestive time means that nutrients do not have enough time to be absorbed through the digestive tract into the bloodstream. So as a result, nutritional deficiencies. And it's nutritional deficit. Okay, and it could create any number of nutritional deficiencies. It can create protein deficiency, B12, magnesium, calcium deficiency, you name that. So, and number 4, okay, suppose person is taking aluminum salts, aluminum 2CO3. That's the formula. It's a chemical formula. So again, aluminum is a problem number 1 with aluminum. Aluminum competes for the seat or for the receptor on the surface of digestive tract with calcium. So both calcium and aluminum, they go through the same passage through the digestive tract in the bloodstream. So calcium and aluminum, so it's the same passage. In the presence of aluminum, calcium gets out and does not have a chance to get through the digestive tract into the bloodstream. As a result, it will create decreased absorption of calcium. And you already know that calcium deficiency contributes to osteoporosis and osteopenia. So I will write here osteopenia. Okay, so the other possibility, and we think that that's a real possibility, we don't know how and we don't know why aluminum can contribute to Alzheimer's disease. Okay, that's basically what I want to tell you about antacids. Please see my other videos on acid reflux. Subscribe to my channel. See you next time. Bye bye.